Hello， 大家好，我们今天邀请到了莫道克大学脊柱治疗的教授，跟大家做一个采访。
My name's Chris Hodgetts. I'm the discipline lead of chiropractic at Murdoch University. So I'm a trained chiropractor. I'm also a registered physiotherapist. I also done my PhD. So I've just moved into the discipline lead role and have basically running the course.
Many of our students may be unfamiliar with chiropractic.
Yes.
So could you briefly introduce to our audience what is chiropractic?
Chiropractors typically work with the spine, not just the spine, but the muscles and the joints related to the spine and the rest of the body to assess, diagnose and treat people that come with complaints in those areas. Pain or headaches or low back pain typically. And so chiropractor will assess that patient, find out what's causing the pain and then provide treatment to try to help with it.
Yeah, that's what modern people may be suffered.
Yes, very commonly, yeah. So low back pain is really the leading cause of musculoskeletal disability, so pain in the spine, and chiropractors are well trained to deal.
From students' perspective view, they may wonder the biggest issue is how about the job market? How do you think of the career outcome for the current students graduates?
Yeah, from our course, we have very good employment rates, and not just employment when they've left their course, but 5-year employment rates as well. So more than 95% of our graduates still remain employed after that 5-year time point. But more importantly, the conditions and the areas in which chiropractors work in are the leading cause of disability in the world. And that's in both in Australia and in China. We have aging populations. And as people age, they have more conditions, they have more health problems, of which spinal complaints, knee, hip complaints are all really common. And these are the things that chiropractors are trained to deal with. So they're very well placed to be required in the future.
Yeah. Can you tell us how about the graduates' annual pay?
It's a difficult one to answer because if you're working in a private area, the wage is going to depend on how busy your practice is. I probably don't have an average figure for you, but what I will say is that because if you are going to work in a private setting, the ceiling of what you can earn is much higher than what it would be if you were working in a public sector. So it's the average is a little bit difficult because it probably is skewed towards the higher end, but that's based on how busy your practice becomes.
How do you think of the pass rate for our chiropractic program?
It's a challenging course, so it's not something that students will just automatically pass through. It is challenging, but we have a very good progression rate from year to year.